أهلا بكم. My talk today will be about one of the important signs on CT scan of the abdomen, which is omental cake. What is the omental cake? Omental cake refers to infiltration of the omental fat by a material of soft tissue density. The appearance refers to the contiguous omental mass simulating the top of a cake. The radiologist is lucky if he found the omental cake sign on the CT of the abdomen because it has limited differential diagnosis. As the differential diagnosis of omental cake is only three causes: either metastasis to the peritoneum, which is known as peritoneal carcinomatosis, or lymphomatous infiltration of the omentum, or tuberculous peritonitis. So these are the three main causes of omental cake, representing more than 95% of the causes of omental cake. So today I will present three cases. One case of tuberculous peritonitis with omental cake. One case is lymphomatous infiltration of the omentum, giving the appearance of omental cake. And the third case is a metastasis from endometrial carcinoma with appearance of omental cake. Before presenting the cases of omental cake, let us review together the normal CT anatomy of the abdomen. These are selected cuts from the abdominal CT with intravenous and oral contrast administration. Starting from the upper cuts, this is the liver located in the right hypochondrium. This is the spleen here. This one is the stomach. This is the fundus of the stomach, the most posterior part of the stomach. This is part of the transverse colon. When we go down, starting this is the left suprarenal gland. Here this is the right suprarenal gland, and after that left kidney and the right kidney. This is the aorta. This is the inferior vena cava here. This is the gallbladder. This is the pancreas here, tail of the pancreas, body of the pancreas, and this is the head of the pancreas. Regarding the bowel, this is the descending colon, this is the ascending colon, and these are the small bowel loops containing intraluminal oral contrast. So this is the descending colon. When we go up, this is the spleen, this is the splenic flexure, and this is the transverse colon. This is the normal fat, omental fat. This is the anterior abdominal wall here. This is the rectus abdominis muscle, the left one. Rectus abdominal muscle, the right one, and this is the linea alba in between, and this is the greater omentum. This is the first case of tuberculous peritonitis. This is CT study for the chest, abdomen, and pelvis with intravenous and oral contrast administration. This is the chest study here. In the mediastinal window here, we can appreciate the normal great vessels of the aortic arch. The first one, left subclavian artery. This is the left common carotid artery, and this one is the brachiocephalic artery. This one is the brachiocephalic vein, left brachiocephalic vein, and this one is the superior vena cava. This is the trachea here, and the esophagus posterior to the trachea. In this image, we can appreciate here we have marked bilateral pleural effusion. This is right pleural effusion here, and this one is the left pleural effusion here. When we go a little bit down, we have mild lymph node enlargement seen here in the right paratracheal area, and the small one also seen in the aortopulmonary window. This is the one here. We have mild collapse of both lower lobes, as you see here. Also in the lung window, there is no other focal lung lesion could be seen except for the bilateral basal consolidation with air bronchogram, as you see here. When we go down to the abdominal study, liver here is normal, spleen, enlarged spleen, pancreas normal, left kidney, right kidney normals. This is the aorta here, normal enhancement. This is the inferior vena cava, and this one is the left renal vein, draining the left kidney and passing anterior to the aorta, as you see here. This is the supermesenteric vein, and this is the supermesenteric artery. You can appreciate here, this is the inferior vena cava. Inside the inferior vena cava, we have intraluminal thrombus, as you see here. Okay, coming down to the region of the paracolic gutters here. Here we have ascites. So this is ascites here, and this is the small bowel loops, and this is ascites here. So ascites in the left paracolic and the right paracolic gutter. Please notice how much the peritoneum is marked, thickened, and enhanced. This is the peritoneum. Normal peritoneum is looks like hairline. It shouldn't be thickened like this. If we go down, we can appreciate more thickening of the peritoneal reflection as you see here. So we have marked thickening of the peritoneal surfaces and enhancement. And here in the region of the mid-abdomen, this is a transverse colon here. Anterior to the transverse colon and under the anterior abdominal wall, we have the omental cake. So this is the omental cake, the sign of our episode today. So omental cake seen in the form of thickening and the nodularity of the greater omentum anterior to the transverse colon and just underneath the anterior abdominal wall as you see here. So all of this is thickening and the nodularity of the omentum or omental cake. So the patient is known case already of TB, and this case representing tuberculous peritonitis seen in the form of omental cake, as well as marked thickening and enhancement of all the peritoneal reflection with also ascites as you see here in between the bowel loops. So this is the first case of tuberculous peritonitis with omental cake. This is the second case, 68 years old female patient, known case of endometrial carcinoma. And again, this is a CT abdomen with intravenous and oral contrast administration. This is the liver here, and this is ascites here in perihepatic area. This is the stomach, left kidney, left suprarenal gland normal, aorta normal, inferior vena cava. This is large simple cortical cyst arising from the upper pole of the right kidney. This is the right kidney here. No masses or stones or any other abnormality. Mild fullness of its pelvic cell system we can appreciate here in this image. Anyhow, the spleen here is normal also. This is the stomach again. This is the right crust of the diaphragm, left crust of the diaphragm. Going to the region of the mid-abdomen. This is a transverse colon, and inside the transverse colon you can appreciate internal fecal matter and the gases as you see here. This is the anterior abdominal wall. This is the region of the greater omentum. Here, this is the classical appearance of omental cake. Thickening at the nodularity of the greater omentum anterior to the transverse colon underneath the anterior abdominal wall as you see here. This is very nice demonstration for the classical appearance of omental cake. If we go down to the region of the pelvis, we have marked ascites and floating bowel loops here. This is the uterus, and inside the uterus we have large hypodense mass lesion representing the endometrial carcinoma. If we go to the sagittal reconstruction, we can appreciate the endometrial tumor as you see here, large hypodense mass inside the uterine cavity as you see here. So this is the second case of omental cake, the case of metastasis to the peritoneum from the endometrial carcinoma, or what is known as peritoneal carcinomatosis. This is the third case of known case of lymphoma. Here I will focus again on the region of the greater omentum here as you see the omental cake appearance seen underneath the anterior abdominal wall, marked thickening and the nodularity also anterior to the transverse colon. We also have marked ascites here also. So regarding any case of omental cake like this, you have limited differential diagnosis, either lymphoma or tuberculous peritonitis or peritoneal carcinomatosis or metastasis to the peritoneum or what is known as peritoneal carcinomatosis, and the most common primary tumor is cancer ovary, cancer stomach, and the cancer colon. So this is everything regarding the omental cake sign and CT of the abdomen, its radiological appearance, and its differential diagnosis. Thank you very much.